All right, go.
Good morning, everyone. Thanks for joining us. We're having a small recording on the holistic approach to tension headaches. I'm Dr. Ravikumar. I have 9 years of experience as a primary care provider, and this is the most common type of headaches worldwide. And also, if you're a younger individual between the age of 12 to 41, the prevalence is so high, it's about 86%. So there's a good chance you or one of your loved ones suffers from tension headaches. And we're here to talk about it, Dr. Muthu and I. And let me start with asking Dr. Muthu, who's a board certified pulmonologist, how he got interested in headaches.
Sure. Thank you for this opportunity, Dr. Ravikumar. So, whenever I see patients in my pulmonary clinic with asthma, COPD, sarcoidosis, uh, or just regular dyspnea, which is shortness of breath without a known reasoning, I usually have access to their past medical history or the other complaints that they usually have. Because we are so used to looking at people as organs and, oh, you are here for this problem of this organ. Whereas once I got into integrative approaches or Ayurveda, for instance, my approach totally changed in terms of trying to see the person as a whole, because uh, the most important reason to present a symptom such as a headache is the fact that all of our imbalances or insults that we have to our organs starts from the gut. That's something that we have learned from ancient wisdom as well as current medicine. And imagine that our organs are different flowers of a single plant. And so headaches, which is usually a presentation of nerves or blood vessels in the head region, um, has very much to do with the same kind of nervous system and blood circulation that also supplies the lungs, for instance. And microbiome in the gut actually supplies all of these different organs with the hormones and the chemical neurotransmitters. So therefore, we have to start looking at our organs as flowers manifesting symptoms at various stages of severity, rather than looking at as, oh, the headache has nothing to do with your asthma or COPD or other states of inflammation. So that's why I started noticing or taking attention of not just the dyspnea or the shortness of breath complaints, but also headaches and other, even OBGYN complaints, such as I usually look at somebody whether they've had history of dysmenorrhea, which is a lot of menstrual bleeding, or have they had fibroids, have they had hysterectomies, and those are all patterns of symptoms that go along with each other when it comes to pulmonary diseases.
That's great. So, have you seen that when you're treating your patient in a holistic manner, not just their pulmonary conditions are improving, but they have improvement in other aspects as well?
Yes, definitely. It takes different timelines for different patients, and it is sometimes very tricky. For example, one of my recent patients started consuming warm water, because there is a general tendency for most of uh, us to consume cold drinks, either it is ice water or cold beverages. And she's had
Sure.
20 years of constipation, and I actually even didn't pay attention to that when she came to my clinic
Hmm.
initially. Most of her complaints were cough and shortness of breath. And kapha, for instance, is one of the words that we mentioned for cough and symptoms of congestion when it comes to lungs. So I suggested that uh, maybe consider trying warmer liquids and see how you feel in a week or two. She messages me 1 week later saying that, do you know, I have had 20 years of constipation. 20 years of constipation. By the way, my cough has not changed at all. It's in fact worse. But guess what? I have started moving my bowels like nothing before. Like 20 years, I've had
Wow, that's
terrible,
amazing.
terrible, terrible constipation.
That's amazing.
I don't know why this happened. I was like,
That's amazing.
Well, you'll take it one day at a time. And what I explain that is that it takes 20 years to get into a severity of imbalance. And similarly, it takes time for the imbalances to correct from one organ system
Right,
to another.
right.
So first gut actually gets better, and then you start actually penetrating the effects of whatever good things that you're doing into subsequent
Sure.
organ systems. So to answer your question, yes, it takes time for different organ systems, but I do see pulmonary patients and some of their other problems end up getting better too.
That's wonderful. So we'll talk briefly on why we are doing this presentation on a holistic approach to tension headaches, why it's even necessary. So what is the tension headaches? And typically you might have experienced it at some point yourself. It's one of those syndrome that some people have it rather infrequently. And it's kind of like you get both sides, and mostly at the back of the head, and this tightness of these muscles at the back of your head and your neck. And it's usually not really triggered by different foods and things like that you can notice, like migraine headaches, but more so to do with stress. About one third of the people who have these type of tension headaches have depression, and they have stressors as their triggering factor in their life. And in our practice, so we normally treat them. Somebody's having an acute attack, we give them non-steroidals like ibuprofen, Aleve. Now, ibuprofen and Aleve, and while they're very effective, they have a myriad of side effects. They damage your gut microbiome, which, like you mentioned, is so important, right? In overall health. And so the gut microbiome is just adversely affected by the non-steroidals, and they cause cardiac effects, and kidney toxicity, and so GI toxicity. There's all kinds of effects, and people end up taking it so regularly that sometimes there's medication overuse headaches itself. People get headaches because they just take too many, non-steroidals or caffeine, along with Excedrin, migraine, and all kinds of over-the-counter medication. Now we have to focus on getting them off of these medications. The other thing we use is kind of antidepressants to help prevent them from coming on. But again, they have a lot of side effects themselves, weight gain, and people just don't like how they feel on the antidepressants. So it's challenging with medications in conventional medicine to treat these headaches. So this is one of the reasons why we want to address what we can do holistically. So I'm going to have Dr. Muthu explain further on on what his approach is regarding, because he's more specialized in Ayurveda, on what his approach is in treating or approaching the patient with the tension headaches.
Sure. So, to set the stage for understanding tension headaches, um, first you need to invest in the stock market for Ayurvedic products. Just kidding. Uh, there's so much stock market interest these days amongst doctors, but I don't know whether you're into it or not. I'm trying to catch up my best. And now, just like pharmaceuticals are going up, the interest in Ayurvedic products is also getting pretty
Sure, sure,
crazy out there.
sure.
Well, coming to the point. So, to set the stage for understanding this, first I need to recall how we understand our body's constitution. We call it body mind or mind body phenotype. So,
Sure.
we have five elements that constitute us: air, space, water, fire, and earth. Very similar to the entire universe that's around us. For example, New York looks different, Seattle looks different, West Virginia looks different, and India looks different. And that's because of the nature of the five elements that make up that place. Like that, each of us is so unique because of the subtle variations of the environment around us as well as what we are made of, right? So, for example, air and space together, we call it as vata, VATA.
Mm.
And so these two mechanisms, which is air and space, function in various parts of our body. For example, movement of the nervous impulses, cardiac impulses, muscular movements, peristalsis of the gut, and in general, we know it just like air and space is always cool, dry, very mobile, and light, and so on. And the next two phenotypes of or apparatuses that work in our body is fire and water. And this is called as Pitta, Pitta, in our mind body complex. And they organize metabolism, digestion, contemplation, like burning thoughts, burning food, and sweating, temperament or temperature of the body, oil secretion, and so on, right? These are all the functions of fire and water in our body. And finally, earth and water. A good example that I give to my patients is imagine a wooden wall and you hit on it. You get a lot of sound because there is more air than
Mm.
earth material in it. Whereas if you try to hit a concrete wall, you can't get too much sound from it because it's more heavily laden with earth material. So, like that, each one of us is different based on how much earth and water we have. That makes us bigger build versus lighter build, or heavy versus thin. So earth and water is called as kapha, Kapha. At least for pulmonary people, we see a lot of kapha patients. So that's a pet peeve for me. So kapha cross, and it lays the foundation of structure like bones, muscles, fat, mucus. In fact, in Tamil, we used to call kabam, which are nothing but
Right, right.
half. And joint lubrication. It's so amazing to understand that the lubrication in the joints is also produced by the same kapha physiology. And similarly, in our mental part, the sense of generosity, love, because usually kapha individuals are very down to earth because they are made of earth. Right. So these are the fundamentals. Out of these, although all the three forces, Vata, Pitta, Kapha, in short VPK, they work together to manifest health and disease. Vata seems to be a major force when it comes to headaches, um, especially tension headaches, right? So when we organize our Vata in our environment around us as well as the inner environment in a consistent manner, for example, predictable schedules, allowing our natural calls, nature calls such as pooping, peeing, and so on without delay, which is very underestimated or overlooked, but I'm hoping we can understand that. Meal times, sleep times, drinking water, and consistent times for exercise, very gentle or to moderate exercise. These are definitely overlooked in our current trends due to either social commitments or professional responsibilities or laziness coming from your body type itself, or not planning ahead, right? So accepting more responsibilities than what one can handle, not knowing when to say no at workplace or at home, and not standing up for one's own self-care, and presence of social and professional insecurity due to deadlines that you put on yourself. So these
Right.
are highly likely to disrupt your milestones for the daily routines that you have, because we are so good at helping others, right? But
True.
we take care of ours the least. In fact, they say to be selfless is actually to be selfish is actually one of the most selfless acts of a human being.
Sure. Sure.
Because we get validated when we help somebody, even if we don't eat on time, or even if we don't sleep on time, and they call it burning the midnight oil sometimes, right? So we know that from current science and even ancient wisdom that the disruption of the biological clock or the circadian rhythm affects the state of peace or happiness amongst the microbiome, the healthy bacteria and fungi in our body. And other triggers for Vata type or tension type headaches include coarse, very dry, raw food items consumed by people more so than cooked and oily, and then eating up in heavy quantities at the wrong times, late in the night, or inadequate quantities during the middle of the day. Those are all classic for Vata headaches. Over time, you may not see that this was the trigger for that particular episode, but this accumulates over time and predisposes you to
Right. Right.
Vata type headaches because It's all about the inconsistencies. Similarly, coldness. If you get, you will see right now it's Vata time of the year. It's winter. It's dry and cold, and this is classic for Vata headaches. Now, let me tell you one thing. Kapha people or Pitta people, for example, Kapha is examples would be opera. Pitta people would be Steve Jobs, and Vata people would be Audrey Hepburn. These are classic examples. It doesn't mean that Kapha and Pitta people cannot get Vata type of headaches. They can always get it because it depends on what you do that makes you get the imbalance.
I
So,
see.
some similar examples. So getting exposed in the cold winter breeze, excessive exercise or sexual activity, lack of, this is one of the most important things, lack of mental rest between chores at home or in the hospital or our workplace, without being able to take a deep breath and relax. That is one of the most important things to remember as accumulative trigger for Vata type of headaches.
So, like, if you women especially are very good at multitasking, or we think we're very good at multitasking, and our brain is really taxed, right? Because we tend to do so many things at once, right? We are answering our phone, we are, answering messages at work, and there's just too many things going on. So, in a way, we're probably setting ourselves up for the tension headaches. What do you feel about the impact of the phone's blue light on the Vata type headaches? How do you think that impacts it?
Sure, yeah. It all depends on the moderation, the extreme spectrum that you may see. That whenever we have electromagnetic waves,
Mhm.
when we get too much exposed to electromagnetic waves, that actually, I mean, we are actually a form of energy. We think we are a form of matter that's moving around. No, we are actually energy that's actually
Definitely.
moving around. It happens to be that we are able to see us as matter. So
Right.
there is constant exchange of energy between things that we use in our daily life,
Sure,
and
sure.
therefore those definitely impact on how much of energy that you consume, because you have to process this energy definitely in a meaningful way. And simple steps would be to avoid any blue light after 8 p.m. in the evening, so that melatonin secretion also happens to
Definitely.
be synchronizing well with the amount of blue light. uh,
Right.
so trying to put a hard stops on yourself it goes a long way.
Right, right. That's yeah, that's a good point, especially with the phone. And I think it impacts the posture. Constantly looking at the phone, and that has something to do with this tightness. And and all of our emotions are associated with some physical symptoms too. So, some of us, when we get really stressed or anxious, we might get diarrhea. Some of us, get a headache. Some of us get tightening in the shoulders,
Mm.
especially a lot of women get tightening in the shoulders, back of the neck. So we carry our emotions in different body parts, and it's
In fact,
kind of good to be.
sometimes we don't realize that we are like this, and
Yeah,
then
we don't realize that. Yes, that and then, like, the different postures, like looking at the phone with your neck stooped, kind of all day long, not taking breaks. Um, and even if we can take like a 10 breath break, I mean, every 20 minutes.
guess what, my mentor, all she asked me
Uh-huh.
to do was just before entering a patient room,
Right.
before every patient room, she asks me to take one deep breath.
Oh, that's wonderful. Just one.
So
That's
this is
wonderful.
much more achievable.
Yes, more achievable. Like
and
the Japanese method, the Zen method. When it's one, we can do it. When it's 10, we're like,
and when I
maybe one.
talk to my patients also, I
Mm.
end up telling about this, so I get
Yes,
an extra breath because I just took an extra breath while showing them this is how you do
sure.
it.
So, what do you think diaphragmatic breathing does for you in terms of, relaxation and the relaxation response, and, just in terms of, um, uh, helping with these headaches as a form of mind body meditation? Again, you're bringing attention to your body, so your
Absolutely.
mind is calmer. So,
That
can
is
you?
actually the connection between the
Uh-huh.
brain and the
Right.
lungs. And most of the energy that we consume is only in three forms. One is
Mhm.
through the air that we breathe,
Right.
through the five senses that we see and other senses, and ultimately the food that we eat, if we burn it appropriately. And therefore, As a lung doctor, I see a lot of patients with anxiety and breathlessness. And whenever these two mingle with each other, uh, the headaches happen to be just a bystander, and you tend to think that they have nothing to do with your patients who are coming in with anxiety or asthma issues. But then it actually manifests in the form of tension headaches, even if they feel that their asthma is not, terribly out of control or so.
Sure, sure.
So we tend to disassociate symptoms and think that their asthma is under control. And that's when I say, I don't know whether your asthma is under control or not, just because you're saying, your breathing is not terrible. Maybe you are not actually walking enough to be even able to get short of breath. Uh, but you're saying your headaches are out of control. So maybe, the root cause is still there. And that's when I say that consistency in breathing exercises is you know over cannot be overemphasized, because we have so many things to do in our daily life, and just one moment, if you can set aside for uh, deep breathing
One,
exercises.
one solid breath. Yeah,
Yeah,
for
and,
yourself.
and, and we can start off simply with belly breathing, which is where
Yes,
you use more of
the
your
diaphragmatic breathing. Yeah,
yeah, and that's because the lower part of your lungs actually have more amount of blood vessels than the upper part. And we know VQ matching is happening more so here rather than here. And therefore, whenever we become anxious or get tensed,
hmm,
we usually tend to breathe here because we are up and trying to be anxious. But then that's when the very fact that you are breathing with the lower part actually grounds you. And
true.
so
Yeah,
that actually, we call it chakras, and we have different centers of chakra,
mhm.
and that actually brings down back the chakra towards the root rather than being up here. So that's
Sure.
where the diaphragmatic breathing actually helps.
So diaphragmatic breathing can be a good tool. Any other breathing exercises you can suggest?
Absolutely. One is alternate nostril breathing. We call it as an umbrella term pranayama, but alternate nostril breathing starts off with
One breath in through one nose, and then you release through the other one. That's right. And there's some significance of these fingers that you're using, the thumb, and I think you use the little finger, right? The thumb
yeah.
and the little finger. Yeah.
Some
So
people, they have tiny fingers, so they're able to just completely close the nostril with just one finger. And
sure,
if you need all the fingers, you can always use
sure.
all of them or two of
That's
them.
a very easy breathing exercise that actually people can just do in bed. The alternate nostril. Even I think belly breathing, definitely don't want to do it if you've had food to eat and you don't want to do too much belly breathing, diaphragmatic breathing.
Yeah, in fact,
But
once you do the breathing exercise, even 5 times, I would have my hands open like this on your lap.
mhm,
Just feel the electrical impulse that actually flows around in your body. We usually call it as respiratory alkalosis, almost like you're about to pass out, but you don't need to do so intense of breaths. But once you do even 5 breaths, you will actually feel the energy going through your body. So it's
oh,
not
that's
just
one.
about practice, but also at the end of the practice, actually receive or sense the effect of what you practiced.
Sure, sure. Yeah, that's really wonderful. Um, so you need to pacify your aggravated dosha, which you mentioned in the case of the tension headaches is more so vata. So there are some certain nutrition changes, right, that you recommend for the vata people.
Yeah, absolutely. To keep it simple,
Yeah,
Vata is cold and dry. Therefore, if
right.
possible, you can try to do everything opposite to Vata.
War.
You don't have to be extremist towards warming stuff. It doesn't have to be extremely spicy all the time, but trying to balance between all the six
Mm-hmm.
different tastes. One is
Sure.
sweet, salt, and sour, bitter, pungent, and astringent. So
Mm-hmm.
trying to keep it all through, and then preferably a little bit more of warmer or warmth inducing vegetables and fruits. So if you look up Vata reducing foods on Google, there's a wonderful list of stuff. Simple examples would be sesame based things such as sesame oil, sesame seeds. Those are some examples, and things that are Um, Sweet, salt, and sour, right? Potatoes, those things are very hard to digest. So in general, what happens is they end up making you burn more because you produce more
Mhm.
energy to be able to burn them. So you create warmth by that also. So those are examples for diets.
Sure, sure. And so, in terms of physical activity, you said you mainly recommend some kind of gentle exercises.
Definitely.
Not-
So, the thing is, you may find that patients are on the obese side,
Mhm.
which is usually called as kapha driven, but still they will have vata uh, reasons for headaches because they used to have been very stable, no worries, no anxiety, that kind of people, but suddenly something has changed in their life recently that now they are manifesting vata type of personality, like a small amount of Audrey Hepburn inside opera. And so for that, you may say, well, kapha people, which is obese individuals, they should ideally walk more so that they can
Right,
lose
right.
weight. Um, but then for vata individuals, you're saying they are usually on the thinner side. But then in these guys, what you do is balancing the amount of grounding activities is more a mental experience rather than a body exercise. So they can continue to have a conscious exercise regimen. However, what they need is they should not jump from chore to chore to chore, rather mental relaxation, but then physically active.
Right, right, right. So there's a physical activity probably that brings that individual more joy, and it's not really stressful or
Yeah.
too strenuous for that individual. Might
For
be
example, I see patients who are grandmothers and they have granddaughters to take care of, and they'll be like,
right,
I cannot sit in one place. I have too much going on in my house.
right.
And I have to wait until I finish my work, get to relax. And that cannot happen. You